Good evening and welcome to Doctors on Call. What does this year's flu season promise? And how will the flu shot measure up? What other infectious diseases should we be on the lookout for? What are the best immunizations and treatments? I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth. I'll be your host for our program tonight on infectious disease and immunizations. We'll be happy to answer your questions. Just give us a call. Locally, you can call at 218-788-2844 or toll free at 877-307-8762. I'm pleased to welcome our panelists this evening. Dr. Lisa Prusak, a specialist in family medicine at the Duluth Family Medicine Clinic and Residency Program. Dr. Paul Sanford, an internal medicine specialist with St. Luke's Internal Medicine Associates. And Dr. Linda Etta, an infectious disease specialist with St. Luke's Infectious Disease Associates. When you call tonight, you'll be talking to one of our medical students. Elena Fry-Naharo from Hinckley, Jill Labine of Keewatin, and Nathan Ratner from Minneapolis. And now on to tonight's program on infectious disease and immunizations. Thank you for joining us. So let's start out. There was something on there about flu vaccines. Now, so is it too early to get a flu shot this time of year, Dr. Prusak?
No, in fact, we just got our flu vaccines, and we'll be starting our vaccine clinics next week.
So it's not too early. They'll last throughout the winter and flu season.
They should.
Excellent. Dr. Sanford, what's new on the flu shots this year? Anything new?
Well, we're going to hope that the spectrum of bugs that they tried to cover are effective.
And are there different flu vaccines for different age groups?
Yes, there are. If we look, last year was a very challenging year for us for influenza. As much as we think we know about influenza, we realize more and more there's a lot we don't know about influenza. Last year, as you know, it was very commonly reported that there was a drift, some mutations that occurred in one of the strains. There's 3 strains that are in the vaccine, 2 A strains, an H1N1 and H3N2, and then a B strain. And we had a drift, and unfortunately it was the predominant virus that was circulating for our influenza season last year. So we had, needless to say, we had a lot of people, even those who were vaccinated, who ended up with clinical influenza. They were ill. We ended up with a lot of hospitalizations. And in the end, the CDC reported that that vaccine only had about a 34% efficacy. So we're much more optimistic for this year. They've changed out 2 of the 3 strains in the vaccine compared to last year.
Sure.
So we're hoping that there's a better match. And yes, anyone, the influenza vaccine should be given to everyone over the age of 6 months, 6 months and older in the country. And there are pediatric, versions. There are intranasal live versions for children and for up to age 49 or so. There's kill vaccine. We have a trivalent with 3 strains, 2 A's and a B, and we have a quadrivalent this year too with 2 A's and 2 B's. You can get either one. We have a high dose potency one for our senior citizens, since we know they don't mount as good a response. But even if you don't have that available to you, get the regular dosing as well.
I hate to ask this question. What's a senior citizen? What age?
It's recommended for people 65 and above, and okay. Medicare will pay for that. So, and the other thing is we actually have a vaccine that is totally egg-free for people who are highly allergic to eggs.
Right.
And so we do have that available as well. So there's really no reason not to get an influenza vaccine.
Excellent, thank you. Dr. Prusak, what are the symptoms of influenza?
Influenza it hits you like a ton of bricks. You get sick right now, and you can get sick within 24 hours or 48 hours of exposure to somebody with influenza. High fever, shaking chills. You feel like you've been hit by a truck. That's usually what I.
So it's more than just like a head cold kind
right.
of thing.
And people look sick. I mean, generally speaking, if you're in one of those epidemic times of year, you can really look at somebody and you just know that's what they've got.
And they're going to have fever.
Yep.
They're going to have fever,
high
severe headaches,
yep.
severe aching. I've even heard patients tell me their eyelids ached. It's influenza is not a mild disease.
Right.
Yeah. And influenza is not the nausea, vomiting, diarrhea.
Right.
Right.
thing. A lot of people say, I had the flu, and they'll describe nausea, vomiting, diarrhea. That may be a Norwalk virus, but it's not going to be influenza.
Sure. Thank you. Well, Dr. Sanford, here's a caller wants to know, how long does a pneumonia shot last, and how often should you get one?
Great question. Great question. There are a lot of different populations that need them at different intervals. People who don't have a spleen, they need them at least every 6 to 10 years. People who have sickle cell disease where the spleen just doesn't work, same story. People who are immunocompromised, had a heart transplant, bone marrow transplant, we really have to cover those people. So generally, most people have gotten the 23-valent vaccine before. Now there's the Prevnar 13 that we give as well. And yeah, there's no reason why we shouldn't be doing that at least every 10 years for all comers.
Right. All of the children in their childhood series do get a pneumococcal vaccination. But then when we had this availability for adults, where we had the polysaccharide vaccine, the 23-valent that Dr. Sanford was referring to, and that's recommended for everyone age 65 and older. You just get one immunization. But then, as Dr. Sanford said, for special populations, people who are significantly immunosuppressed, you give it earlier than that, and then you repeat it after age 65. But the new news is we now have the adult conjugate pneumococcal vaccine, which is a 13-valent. And the thing is you have to be careful in which sequence you give them. Because if you give the polysaccharide one first, you have to wait a whole year before you can give the conjugate one.
Oh, interesting.
But if you give the conjugate one, you can give the polysaccharide one 8 weeks later. So you have to be certain that your physician's office knows what they're giving. For example, Medicare has decided to pay for both of them for our senior citizens, but you have to give them a year apart, whichever sequence you give them in. So you have to give them a year apart. So we strongly recommend that people get both of them, and that's the new one. So you probably have seen some direct-to-consumer advertising about the new,
Sure.
one and done, and that's the new one we're talking about. So it's gotten a little more complicated in that we now have 2 pneumococcal vaccines that all adults at some stage in their life should get.
Thank you.
I think another thing to talk about, which I think is really interesting, one of our nurses who's been there for 35 or more years brought up the other day when she knew I was coming on to this program, is since we've been immunizing children with the pneumococcal vaccine, we don't see ear infections like we did in the past.
Interesting.
You know, we used to have 6, 8, 10 kids a day with these bright screaming red ears, and pneumococcus is one of the most common bugs that causes ear infections. We don't see that much anymore. So that's really a step ahead that we've gotten with these wonderful vaccines that we have for children.
Well, and the other thing too is on that same vein is the Haemophilus influenzae group
Right.
B. I mean, I'm old enough in my career, I can't tell you the number of children I admitted with Haemophilus influenzae, meningitis, perioral cellulitis, and we did not have good drugs for treating it. And now in Minnesota, you can count on one hand or less the number of invasive cases of Haemophilus influenza group B infections that we have in children. And that's what people don't realize. The 2 things in the history of mankind that have saved more lives than anything else are access to clean water and vaccinations.
Yep.
And that's why it's really important to do that.
Dr. Prusak, I have a caller here, 59-year-old male from Friedenberg Township here in Duluth, outside Duluth. And a good question. He never has had mumps, measles, or chicken pox. Should he get the shingles vaccine? What vaccine should he get?
Well, most certainly, how old is he again?
59.
Okay. Over the age of 60, is that correct? That the shingles vaccine is indicated for people over the age of 60, some believe 50, but it's covered over the age of 60 to a certain extent. And he most certainly should get that regardless of his prior infection history. With regards to measles, he could either get the immunizations or he could be tested to see if he actually
Right, yeah,
had
I
it.
was going to say a lot of times
Yeah.
people
Oh,
have
yeah.
had the illness
Right,
and didn't
and they didn't
realize
know
it.
That's right.
But
You know-
some believe it's more expensive to get the test than it is just to get the immunization. So it's
Yeah.
just however you feel about
The
it.
shingles vaccine, first of all, I mean, that is the varicella zoster virus, which causes a chicken pox when you're a little person and then stays in your body and then can reemerge as the shingles. And it is such a contagious virus. It's second only in contagion how easily it's spread compared to smallpox. And so it's very unusual for someone to get to adulthood without having had it, even if they don't remember it. the couple of things we'll say is, you're right, the FDA has approved the shingles vaccine for anyone over the age of 50, but the CDC in their immunization advisory committee is saying don't get it before the age of 60, because we know each decade that you get older, your risk of shingles increases, and we don't know how long the immunity is going to last. The other thing is we have to remember too is, and I want everyone to pay attention to this, is because this is a live vaccine. So anyone who is immunosuppressed, being treated for lymphoma, has leukemia, a organ transplant patient, someone who's on steroids and that, they cannot get this vaccine, or they could actually get clinical disease. Now, the good news is we have a couple of killed zoster vaccines that are in their later stages of testing, and I'm hopeful we'll have those on the market within a couple of years. But I want people to be careful about that vaccine and make sure that they are not in that category in which is contraindicated.
Thank you. Dr. Sanford, a caller from Duluth, she had a flu shot in her arm, and her arm hurt for 6 months.
Eesh.
And now she's wondering about getting the inhaled vaccine, but insurance won't cover it. Now do you have any idea how much a flu vaccine costs? The nasal one?
The nasal, I have no idea what it costs, and it's true, some people really hurt. Sometimes if you get the shot too high up in the shoulder, it can actually go into the joint capsule, and that is
Or into the tendon, which will cause pain for many months.
Misery.
Right.
So you don't necessarily have to get it into the deltoid muscle. I think you can give it, if people prefer, in
In the thighs.
the
yeah.
rear end or thigh.
Not in the buttocks, but it's
Right.
supposed to be preferably in the deltoid. But you're right, if it's given too high, you can end up with that pain. As far as the live attenuated, which is the nasal, what people call the flu mist, that's approved for ages 2 to 49. But I strongly recommend that no adults get that. And I'm basing that on the fact, if we remember back to the influenza pandemic, the swine flu we had in 2009,
Oh, yeah.
which was an H1N1, if we remember the first vaccine that was available, and we were desperate for vaccine to come, the first vaccine that was available was the live attenuated, and so a lot of our healthcare workers who were younger, under the age of 50, got that. And then the studies that showed later it was very, very ineffective. It's best in younger children. And so I don't recommend that adults get that, even though it's approved for that. I think you're going to get a much better antibody response if you get the kill vaccine, the injection.
In the muscle.
Dr. Prusak, it was a caller with a cold sore in her eye. And, what do you do with that one?
I would see my ophthalmologist.
Right.
I think that's very important to get in to see somebody who knows something about eyes as soon as possible. If in fact it's the virus that causes cold sores in your eye, it can be very, very serious.
That can very, very much scar your cornea.
Yeah, we don't want that. Dr. Sanford, a caller here, wondering, do you expect this flu season to be bad this year?
Boy, I expect the Twins to win the pennant. I don't know. It's a
Who knows, huh?
crapshoot. Every year we just get on our knees and pray that it's not a year where 50,000 Americans die. You know, it's astounding. We just do our best. Good hand washing. If you're sick, for heaven's sakes, don't go to school, don't go to work, don't share it with other people. Just the rules that Grandma used to have. Wash your hands, and if you're sick, stay home.
Should they wear a mask?
Well, it's not going to do much, probably. It'll take care of some of the particulates, but when you sneeze, you know, those droplets are microscopic. You can't see them. Somebody's going to walk through your path and inhale them. So stay home. But it's impossible to know how bad the virus is.
So thank you. Dr. Vanetta, we have a caller from Duluth who has myasthenia gravis, gets IVIG. She had a flu shot last year and said she reacted to it. Should she continue to get flu shots even though she has some immunosuppression thing going on?
Well, if she got the flu shot, that would be a kill vaccine, so she wouldn't have any possibility of getting actual viral illness. And I'd want to know what her reaction was. How did she react? Did she just get a soreness in her arm? And at what age is she? Did she get the high dose? If so, because we know with the high dose, which is 4 times the dosing, because we know our senior citizens don't mount a good antibody response, they will have an increased local reactions with more pain and swelling in that. So if that was the case, she could switch to a different one. She could also try if it was really determined that she did have a severe allergic reaction, she could try switching to the egg-free one.
Okay.
But it doesn't sound like that was a real anaphylactic reaction. So you'd want to
Doesn't
know.
sound like
You'd want to
it,
know
yeah.
what she had actually happen.
Okay, Dr. Prusak, I've got a good question for you. And I'm going to get a little political here, at least mention that Donald Trump the other day said that there's a connection between autism and vaccines.
My
And,
buddy.
and we have a caller wondering about that too. So maybe it's Donald Trump calling. I don't know, could be.
Could be.
So anyway, he wants to know, Donald wants to know what you think of that.
Well, I'm afraid I will have to severely disagree with Donald. There's absolutely been no evidence whatsoever, and it's been studied and looked at upside down and backwards, that there is any relationship between autism and vaccinations. And I think all of us, if we could have a band here and we could, rah, 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 there is no
Right.
association at all. And I think this is a good time to say that in this country, there is a lot of misinformation out there a lot of access to misinformation on the internet and in other places to get information, whether it's through, different relationships with people or different groups you might belong to. But please, please, please know that, like Dr. Vanetta said, one of the best things that's ever happened to the world with regards to health is vaccinations. We have eliminated smallpox. We were on the verge of eliminating polio.
We only have 2 countries left.
Yeah, and when I was in Bangladesh, just 25 years ago, I saw so much polio. It was absolutely
Amazing.
heart-wrenching.
And we've totally eliminated polio from the Western Hemisphere. So
And
we just have
amazing.
2 countries left.
That's not a long
Afghanistan and-
period of time, and that's how wonderful and effective vaccinations are. And
And that's my feeling is when I think to lose a child, particularly to a vaccine preventable illness, that is just such a tragedy. And that's the other vaccine I talk about then in regards to that is, and there's a lot of direct-to-consumer advertising about this, and that's the pertussis vaccine. We have so much pertussis now, but it's not occurring in the children, it's occurring in
Right.
the adults.
Adults.
And they don't have the usual presentation, but they get quite sick with it, and we can't really effectively treat it. We treat with antibiotic just to stop the spread of it. But I've had adult patients with pertussis who've coughed so hard they've broken a rib, have coughed so hard that they have ruptured a disc. But the biggest thing is our little babies
Right.
who are very susceptible to this, and they can't start getting their immunizations for this until they're 2 months. So it's all pregnant women now get a pertussis, an acellular pertussis vaccination during their latter part of their pregnancy, and it's repeated even if they have a baby every year because they pass that immunity on to the baby. And then we strongly advise that no one around that infant
Right.
come close to that infant who hasn't been immunized against pertussis. And we have children every year in Minnesota that are hospitalized and on ventilators with
Right.
whooping cough is the common term for pertussis.
Yeah, that shouldn't happen in a developed nation.
No, it
it's
should
just
not.
obscene.
The other thing is, people have become complacent because they haven't seen these diseases.
Exactly.
A lot of doctors
Wouldn't even
haven't-
recognize
right.
measles in that
They've
now.
never even seen chicken pox,
Right,
let
right.
alone, who's seen measles,
Right, and that-
unless
diphtheria.
you've lived overseas, right.
Right, and that's why when we had the measles outbreaks that were happening, particularly with the one that started at
California,
Disneyland,
yep.
and that I sent out to all of our physicians in the St. Luke system pictures of what measles looked like, all the symptoms to know how to recognize it, because measles can be very easily spread in a clinic.
Yep.
But I have to congratulate California because they had over 100 cases of measles from that Disneyland outbreak, and they recognized it was an opportunity for them to improve. They have a very high rate of 25% of their schools. They had high children being exempted from vaccines. We need to have 92 to 94% of children vaccinated for that particular illness to have herd immunity. So what they did is they grabbed this opportunity, and the California legislature passed, and the governor, Jerry Brown, signed one of the strictest vaccine rules in the country, where there no longer is any exemption for religious beliefs or for personal preference. So if your child is not immunized in the state of California, that child cannot go to daycare or go to school. And so I applaud them for doing that, and they've joined Mississippi
absolutely.
and West Virginia as the 2 other states that have that.
Well, we should be moving along here. Now, there are some questions here. I'll go with that. They're well said, by the way, very well said. Well, shingles. The shingles vaccine has created quite a stir here.
Oh,
and
boy.
good questions, though. I mean, basically, they revolve around, if I've already had shingles, do I need to get the vaccine?
Well,
yeah,
Dr.
yeah.
Sanford.
Yeah.
Yeah, we can assume that you've been exposed to varicella zoster. You can assume that the DNA is living in your nerve tissue. If you've already had the vaccine,
No, if you already had
or had
shingles.
shingles.
Yeah.
Good question. You know, the efficacy was at incidence of shingles in people who had the vaccine was 2 in every 1,000 over 3.1 years that they did the study, and it was 5.8 per 1,000 in people who didn't have the study. So about a
Cut the
50%.
risk in half.
Right.
Yeah.
For
it's-
first episode, they
First
never
episode.
studied patients who had, whether they should have it if they've already had shingles.
Yeah.
But the CDC recommended
Yep.
that they go ahead and get the shot. Yeah.
We've got another question here, Dr. Vanetta. I just saw it here. Well, first of all, there was for Dr. Prusak, we have a caller wondering where you practice medicine because she's very impressed.
Oh.
How about that? That's pretty good.
Well, I'm faculty at the Family
the
Medicine
Family
Clinic.
Medicine
Yep,
Residency
and so I
Clinic.
teach residents to be family practice specialists.
Excellent.
Thank you.
So, Dr. Vanetta, a patient with lung cancer and has kidney disease, should they get the chickenpox vaccine?
No, they probably shouldn't get the zoster vaccine especially if they're on active chemotherapy for their lung cancer.
Right. Let's see, I'll go to Dr. Prusak then. A male from Wisconsin with achalasia, with esophageal problems, and has had pneumonia. What vaccination would be best for him at this time?
Does
Would
it
this
say how
be
old he is?
65.
Well, that's the whole pneumococcal vaccine series that we were talking about, whether you starting with, depending upon if he's ever had a vaccine in the past. There's a very specific routine to get the 13 valent and then the polysaccharide vaccine.
Yeah.
23
23.
He would be a good candidate for that.
Absolutely.
Absolutely. Dr. Sanford, a woman calls from Cloquet who wants to know, she gets her flu shot every year, good for her. Do seniors automatically get a stronger dose, or do patients have to ask for it?
Well, we've generally been giving the high dose vaccine to anybody above age 50, 60.
65 is,
Yeah.
is what we do, but not all health systems do that. So she should specifically ask if she's getting the high dose or not.
Yeah.
Good, good. Yeah, it doesn't give her age, but yes,
Can we
that's a
talk
good
about,
point. Might as well ask about it.
The HPV vaccine.
Oh, yeah, human papillomavirus vaccine is a great
So,
topic.
I just wanted to be sure that we touched on that.
So
the-
please, we got three minutes
Even
left.
if
so-
we don't have a, our adolescent population, when they come in for their 7th grade physical, it's highly recommended that they start what's called the Gardasil vaccine, which is human papillomavirus. Human papillomavirus causes cervical cancer, oropharyngeal cancer, anal rectal cancer. What else am I forgetting? There might be one more.
I think, some foreskin tumors, but yeah, huge.
And this vaccine is a wonderful, very extremely effective, one of the most effective vaccines that's ever been developed.
Well, it started out, they just had it for girls.
Right.
But now it's
Yeah,
for
now it's for
boys
everybody.
also.
Right.
Right.
It's a series of 3 that is supposed to start or can start at the age of between 11 and 12 years old. And it can be given up to the age of 26 if you haven't been vaccinated. It's not being utilized the way it should be, and I hope that we can deliver the message that
Absolutely.
we should be.
Yeah, it goes up to age 26, as Dr. Prusak said, for women, and up to age 21 for men, with the exception that men who are HIV positive or men having sex with men should get it up to the age of 26. So.
Very good. And finally, maybe the last question for Dr. Sanford. A woman from Duluth who calls, she reacted to the H1N1. Again, we don't know what type of reaction. And she's on immune globulin now and getting steroids. So should she get a flu shot again?
Yeah, she should get the flu shot, and depends on what type of reaction she
Yeah,
had.
I mean, minor reactions are fairly common.
Yeah, it'll turn
Sore
red
arm
and
or a
swell
little
a little bit.
redness
Right.
or
Even a low-grade fever you can
Right.
have, and that's not because you're getting the infection, because it's a killed vaccine, but it's because your immune system is mounting a response.
Yep.
Very good.
Get your shot.
Excellent. Well, thank you for all your great questions tonight. I think, and thank you for your answers. It's the immunizations it's a hot topic, but again, they're very curable. Prevent very curable illnesses that are severe. And I'll also put a plug in for the meningococcal vaccine for your students, your children that are going away to college.
Yep.
Very important.
And that's important because we just have a new vaccine. Our usual meningococcal vaccine protects us against strains A, C, W, and Y, but the new ones that are circulating amongst our college students is B. So we just have brand new meningococcal B. So think of 2 meningococcal vaccines now for your kids going away to college.
I want to thank our panelists tonight, Dr. Lisa Prusak, Dr. Paul Sanford, and Dr. Linda Vanetta, and our medical students, Elena Fry-Nahara, Jill Labine, and Nathan Ratner. Please join Dr. Ruth Westra next week for a program on women's health, when her panelists will be Dr. Gail Baldwin, Dr. Melissa Miller, and Dr. Nicole Seacott. Thank you for watching, and good night.